Good afternoon. Thank you very much. I'm Ranak Trivedi. I'm a clinical health psychologist and a health services researcher. And thank you for the introduction. I'm very excited to share with you my vision of a society that rewards caregiving and the kindness that's inherent in that. Apart from today being World Kindness Day, November is also National Family Caregiver Month. And so this really brings my two passions together. I want to start by sharing a story that is likely apocryphal, but it goes like this. The famous anthropologist Margaret Mead was asked by a student what she considered the first sign of human civilization in a culture. And people expected her to say something like, when we first found evidence that humans knew how to make tools to then hunt, or when humans built clay pots to preserve water and food for later use. Instead, as the story goes, she said the first sign of human civilization was a bone that was discovered at an archaeological site. And the bone was the femur, which is this bone. It's the largest bone of your body. And the bone had shown evidence of a fracture, but also of healing. And at that time, ancient humans would go from place to place looking for food and shelter. And a bone of that size, without modern medicine, would take weeks to heal, and they would require complete rest. So what she said is this caregiving, this tending of somebody who could have just been abandoned, but instead, at least one person decided to take care of them, is the cornerstone of human civilization. Now, when we talk about caregiving, we mean a lot of different things. It could be parenting, it could be care from the healthcare teams, it could be grandparenting. But today, when I'm talking about caregiving, I'm talking of people, adults who are caring for somebody with a medical or a mental health condition. So having said that, I'm curious, how many of you would consider yourself as caregivers? If you can raise your hand, that'd be great. It's okay if you don't, or if it's okay if you don't want to share your hands. It's a small group, so it feels vulnerable. But that's okay. Bring that image to your mind. Think about the caregiver that you have in mind. Maybe it's you, maybe you're the care recipient, maybe it's just a family member. What gender are they? Think about the person they're giving care to. What's their relation? Is it a spouse, a parent-in-law? Where are they giving the care? Is it at home, in their own home? A hospital, a care facility? Imagine the face of the person giving the care. Do they look happy? Do they look stressed, sad? Now, keeping that image in mind, I'm going to share with you some statistics that we know from national surveys in the United States. For those of you who raised your hands, you're in good company. There's 53 million adults in the United States who say they are caregivers. 2/3 of these caregivers are women, which means 1/3 of caregivers are men because we don't really have data on non-binary caregiving, unfortunately. Now, there's distinct differences in how women give care and men give care. Women are more likely to provide intensive hands-on care. Men are more likely to purchase care. Women are more likely to provide emotional support. Men are more likely to provide financial support. Women are more likely to drop their work hours or leave the workforce completely to become a caregiver. Because of this, women face loss of income, loss of benefits, and delayed retirement or no retirement alone. And these disparities have become even more pronounced during the pandemic because we have documented evidence of the number of women who exited the workforce to take care of adults or children at home. What do caregivers do? Kind of a little bit of everything. If you've been a caregiver, if you observe caregiving, you kind of know this. They can help manage different medications. They can encourage people to go get their exercise. Their loved ones say, please go get some exercise. Often they're the charge of preparing meals. So when a doctor says you need to eat a low sodium diet, a low carb diet, it's a caregiver doing the work to prepare that meal. They help monitor the symptoms to make sure that the loved one doesn't need to go see a doctor, or they can be managed at home. They're also responsible for making sure they get good preventive care, getting the flu vaccine, COVID vaccine. And increasingly, we are relying on our caregivers to take care of tasks that used to be done by nurses, like wound care, giving injections, dressings, biologics. So it's not surprising that research shows that people who have a caregiver have better health outcomes than those who do not. Makes sense. Ironically, however, this comes at a cost to the caregiver themselves, because caregivers are less likely to get their own preventive care or get their own care in general. Now, caregiving, turns out, brings people joy. The kindness cocktail that was referred to earlier is true here too. In one study, they showed that 83% of caregivers said there is at least one positive aspect of caregiving. And this comes from feeling like you're helping somebody in need. So it's a good feeling. It feels that you're growing in your own roles and responsibilities in your family unit. Now you're entering a new stage of your life, and people feel good about that. Caregivers find benefit in what they're doing. They find that they are getting to spend more time with the one they care about. They feel that maybe their life has more meaning and purpose. And there's a sense that they want to transmit these values to the next generation. So we're role modeling what we should be doing. Unfortunately, it's not all good, because being a caregiver is also associated with high stress, caregiver burden, and depression. And there are many factors for this. Caregivers who provide more intensive care, things like toileting and bathing, are more likely to experience stress. Caregivers who give more hours to caregiving report more stress. Caregivers who pay more money out of pocket to care for the caregivers report more stress. Beyond that, caregivers are also juggling different things. This is not the only thing they do. They have work, they have personal lives, they have school, they have all kinds of different things. They have other caregiving responsibilities. So when the more complex this gets, the more stressful it is. In addition, we as a society and a system are adding burdens to these caregivers. We have created a healthcare system where caregivers feel ignored and underappreciated. We and other researchers have documented that caregivers just feel invisible to the care teams. We've also created a structure where we have no federal policies right now that support caregivers. We can't take paid leave if you're a caregiver. You just got to juggle it out with your work. The amazing thing is we're asking people to do all this without complaining, cheerfully, and without getting paid. And this is not a trivial issue. The unpaid labor of caregiving in the United States is estimated at $470 billion. That's a lot of zeros. That is larger than the market cap of Meta, which this morning was $269 billion. And that's a social company. So if caregiving was a company, it'd been the Fortune 10. Now, all the statistics that I've shared with you today actually is based on non-Asian populations, especially in the West. But we know there are clear cultural differences between the West and the East. And we know that caregiving is embedded in those cultural expectations and motivations. So we are doing work to shed light on this issue. And I'm going to share a little bit of what we know about Asian caregiving because it's very vastly understudied. Asian caregivers tend to take care of parents, more intergenerational care in their home. Asian caregivers often involve the younger generation earlier in the caregiving responsibilities. Women are more expected to take care of, and that's true no matter where you go. However, the proportions are different. In one study in India, they found that 80% of caregivers were women. If you remember, I mentioned that 2/3, so 66% of caregivers in the US are women. And who provides the care is different too. In the US, it's mainly spouses, wives, and daughters. In India, it's mainly daughters-in-law. When you look at the statistics within the US, we have some information. Asian caregivers, whatever that means, that's 2/3 of the world, but Asian caregivers provide, on average, 24 hours of caregiving per week. That's more than a half-time job. And they're doing it while also working outside of a home for about 38 hours a week. So they're basically doing 1.5 jobs each week as they're providing care to somebody else. Compared to other racial ethnic groups, Asian caregivers report higher emotional stress. The majority of Asian caregivers feel they have no choice in taking on the caregiving responsibilities. It is expected of them culturally, and they just have to do it. And this stress becomes more amplified among South Asians and Asians because there's another cultural dimension. Asians are less likely to seek professional help for mental health reasons. So the stress of being a caregiver just gets amplified. Now, we are doing some groundbreaking work that is hoping to start shedding light on these experiences. We are conducting a study looking at South Asian women with breast cancer and their caregivers. And our idea with this is to understand what is it like to be a South Asian person in the US, Stanford mainly, navigating this serious illness of breast cancer, and what is it like to be their family members. And across multiple interviews, this is what we've been hearing. We're hearing that caregivers feel unappreciated by the healthcare teams, but also by their own family networks. We are hearing that caregivers are isolated and they want to be more engaged by the healthcare teams. We're hearing that caregivers need more resources that are culturally tailored and that are available in languages that they can understand. And finally, what we're hearing is caregivers are looking for strong connections with other people like them. They want to get to know other caregivers of women with breast cancer. And this is especially important because cancer is very stigmatized in the South Asian culture. So caregivers of this particular population are particularly challenged because they don't feel they can share their diagnosis of their loved one with the community because of the stigma inherent in this condition. So our vision, my vision, is to create a culturally attuned, family-centered healthcare system. But how do we do this so that our underappreciated caregivers who are using their kindness to give so much to the society, how do we reward them? Well, to start off with, we need culturally attuned materials. We need to build a healthcare system where the materials are accessible. When you are sharing what a dietary recommendation is, and you say leafy green vegetables, it's not going to be salads in most Indian households. It's going to be cooked vegetables. So those materials need to exist. The materials need to be in world languages so that people can access them. Beyond this, we run into the issue of just the built environment. Think of the last time you were in a clinic and how small that space is. What if you wanted to bring 3 other family members to discuss the diagnosis and prognosis with the provider? Where are they going to sit? So our built environment is also culturally not tailored to people who want to bring more people into the fold. It's not enough to start with the healthcare system and end there. We also need to go beyond into the policy land. We need policies to support caregiving. This includes paid leaves for caregivers. This includes stipends to caregivers to offset the unpaid labor and the loss of income. Now, this can become controversial because people might say, well, why should we pay somebody for things that they love to do? They should just want to do it. You should just want to take care of your loved one. Well, I get paid to do things that I love to do. And I can guarantee you my motivation is not going to increase if that salary is taken away. So why would it be any different? Because we are losing income. People need that offset here. We need flexibility in work schedules. I think the pandemic has made that so obvious, but yet a lot of sectors don't have that, where you can't have the flexibility, so that people don't have to leave the workforce to provide care. And then we need universal childcare. Yeah. And finally, we need massive research investments. We need research investments from federal agencies, from foundations, from philanthropic dollars, to shed light on the cultural dimensions of caregiving. And we need funding so that we can take those cultural dimensions of caregiving and take those insights to build programs that are tailored. So I'm going to end with a quotation from former First Lady Mrs. Carter and a fierce caregiver advocate. And she said there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. All of us fall in that bucket. And so we need now to spend our energy, our resources, to support this cause so that we can elevate the experiences of invisible, underappreciated caregivers so that we feel that we can reward the kindness that they're providing to people. So if you're interested in learning more and joining with this vision of transforming our societies to do this, please follow our work and contact me. And I thank you for your time.